There's such a lack of public awareness and education as a whole about all of the symptoms. And in so many cases, it really starts with a significant change in behavior or personality or the way somebody is speaking or managing finances. And so many cases of dementia go undiagnosed, or the diagnosis comes too late because people have missed these early warning signs that are so important.
Welcome back to Elder Abuse Prevention Ontario's podcast, Aging Vibrantly, Conversations to Empower Seniors. I'm Marianne Rideout, the host of the show, where we amplify the voices of seniors who impart their expertise and wisdom to enhance our understanding of aging issues and ways of living a safe and fulfilling life with respect and dignity. On this episode of Aging Vibrantly, we are raising awareness of the issue of dementia in Canada. Dementia significantly impacts the lives of many Canadians, particularly for older adults and their caregivers. Canadians of all ages need to be knowledgeable about dementia, have access to information and support to lower their risk, and also acknowledge their role in combating the stigma surrounding dementia. We are honored to be joined with three esteemed guests, Dr. Samir Sinha, Dr. Jane Rylett, and Claire Webster, who share their wealth of knowledge in research, policy, and practice to help us better understand dementia in Canada. They are also the authors and expert reviewers of the National Institute on Aging's recent report addressing dementia in Canada, trends, challenges, and opportunities in improving public awareness, reducing the risk, and challenging stigma related to dementia. We had such a comprehensive and informative discussion on dementia in Canada with our guests that we decided to release this episode in two parts. In part one, you'll learn about some alarming facts about dementia, including there is approximately 500,000 older adults in Canada living with the diagnosis of dementia in 2023 and 24, according to the Public Health Agency of Canada. And the Alzheimer Society of Canada estimates that the number of people of all ages living with dementia in Canada could be approaching 772,000 in 2025, and further estimates by 2050, this could possibly reach 1.7 million Canadians, with nearly 1 million care partners needed to support them. But we can be proactive in changing these projections by becoming more knowledgeable about the modifiable risk factors that are associated with delaying or preventing dementia. All of us can play a role in challenging the stigma, stereotypes, and discrimination associated with the disease that often inhibit people from seeking a diagnosis, medical care, and support services. In part two, we extend our conversation about care partners' journey supporting someone living with dementia. In previous episodes, we have learned from guests who informed us about the current and future challenges caregivers endure when supporting a family member or friend diagnosed with dementia, and the importance of being informed about programs and services. That's why this episode is so important. We're bringing to your attention the actions that individuals, communities, and governments can take to not only prevent or delay dementia, but also improve the quality of lives of those living with dementia, and empower, support, and prepare individuals for their caregiver journey so they have access to education on dementia, resources, and the skills to care for a person living with dementia. So let me begin by formally introducing our guest, Dr. Samir Sinha. Dr. Sinha is a geriatrician and clinician scientist at Sinai Health System and the University Health Network in Toronto, a professor of medicine at the University of Toronto, the director of health policy research at the Toronto Metropolitan University's National Institute on Aging, as well as a fellow at the Canadian Academy of Health Sciences and the Royal Society of Medicine. Dr. Sinha is a highly regarded international expert in the care of older adults. As a current member of the Ministerial Advisory Board on Dementia, he has helped to develop Canada's National Dementia Strategy and recently led the successful development of Canada's new long-term care services standard. He has been a champion of Elder Abuse Prevention Ontario's work for many years, is a respected advocate for the needs of older adults, and a key figure in Ontario's efforts to improve seniors' care, including the prevention of elder abuse. So welcome, Dr. Sinha. Along with Dr. Sinha is Dr. Jane Rylett. Dr. Rylett is a distinguished university professor at the University of Western Ontario and a scientist in the Translational Neurosciences Group at the Robarts Research Institute. She was appointed as the scientific director of the Canadian Institute of Health Research Institute on Aging in August 2019 as an elected fellow at the Canadian Academy of Health Sciences. She is a past chair of the Department of Physiology and Pharmacology at Western University. Dr. Rylett is a cellular and molecular neurobiologist studying the consequences of age-related changes in the brain and neurodegenerative diseases, and recognized internationally for her contributions in the study of cholinergic neurobiology and Alzheimer's disease, and has worked within the Alzheimer's community for many years. Lastly, our expert in caregiving, who provides programs and services to support those living with dementia and their caregivers, is Claire Webster. Claire is a certified dementia care consultant and professional consultant on aging, and a conference speaker and educator in the field of caring for an individual with dementia. As a former care partner for her late mother, who had Alzheimer's disease, Claire has lived experiences on the impact of the illness on persons living with dementia and the ripple effect on family members. Claire works in collaboration with the Division of Medicine and Faculty of Health Sciences at McGill University, where she is the founder and ambassador for the McGill Dementia Education Program and McGill Cares, a webcast series designed to support family care partners. She's also the founding president of the Caregiver Crosswalk, Inc., a consulting firm that provides education and support services to help individuals navigate the journey of Alzheimer's disease and dementia-related illnesses. She's also one of McGill senior co-editors of the Alzheimer's Disease International World Reports, Alzheimer's Reports in 2021 and 2022. She is a member of the Government of Canada's Ministerial Advisory Board on Dementia. And in 2025, she was awarded the King Charles III Coronation Medal for her dedication to advancing dementia and education and support for caregivers. So thank you all for joining us today. We are so privileged to have you take the time for this podcast interview. I am also joined with my co-host, Tom Warner, who is a member of our podcast Senior Advisory Committee. So I am truly honored to have all of you join us today. So let's begin for this informative and motivating interview today. So thank you all again for attending today for our podcast. We are so looking forward to the interview with all of you to expand our understanding about dementia, the report that you have just put out, and giving people a better understanding of the complexities of dementia, the ways that we can prevent and delay the onset of dementia in cases where people may be more vulnerable, and talk about what we need to move forward with our government to change and implement funding to move the agenda forward, and our policy, practice, and research to address dementia care in Canada. So I'm going to allow or ask Tom to start our conversation today for our podcast.
Hey, thank you. Dr. Sinha, before we begin our conversation on raising awareness on dementia in Canada, can you clarify the terminology of dementia and Alzheimer's disease for our listeners, as there is often confusion on their meaning, and these words are used interchangeably when speaking about someone living with dementia?
No, thank you, Tom, because that's a really good question, because I think it's always good to have our terminology right from the beginning. You know, I have a patient who once told me that, I have Alzheimer's disease. Well, at least I don't have dementia. But then I actually had to explain to them that they actually did have dementia. And so I think it's important to get the terminology right. But dementia itself is an umbrella term used to describe symptoms impacting a person's brain function due to neurodegenerative and vascular diseases or injuries. And so there can be a number of different things that can cause those things. There can be Alzheimer's disease, which is the most common cause of dementias, but there can also be vascular forms or vascular incidences and things that can cause vascular forms of dementia. There can be other more specific forms of dementia as well, but also traumatic brain injuries, other things that can all cause that. So dementia symptoms themselves, though, can include a decline in cognitive abilities, including memory as well as changes in mood and behavior. And these can all interfere increasingly with the person's ability to perform their activities over time. And so I think that's where we started understanding how, despite all these different causes, dementia is quite similar in the way that it can unfortunately rob people of their independence over time.
Thanks, Samir. And I think, often we hear about obviously dementia in the news and in reports. So Jane, like in the recent publication that the NIA, or the National Institute on Aging, just produced on addressing dementia in Canada, the current trends, challenges, and opportunities in improving public awareness, reducing the risks and challenges, stigma related to dementia, as well as many reports that the Alzheimer Society of Canada has put out, we're seeing startling statistics on those living with dementia in Canada. And we know that aging is a risk factor associated with dementia, and we have a rapidly growing aging population. So, based on the current research, how many Canadians are living with dementia, that we know of now?
Rayanne, that is a really, really interesting and important question, actually. It's not clear how many Canadians actually have either mild cognitive impairment or early stages of dementia, or even beyond. The numbers that have been published by the Alzheimer Society of Canada and numbers that you'll find elsewhere are about 750,000 people with some form of dementia, diagnosed with some form of dementia. The numbers from the Public Health Agency are a little bit less, more about 500,000 people. Regardless, it's important to realize that not everybody that has some form of dementia or mild cognitive impairment, which has a high risk of leading to dementia, actually have been diagnosed. And so it's estimated that there could be about 30% of individuals with some form of dementia or very early dementia that have not actually been diagnosed. So the numbers are probably much larger than the numbers that you find in various reports. The important thing to realize is that the numbers are increasing, in large part because our population is aging. The number of older individuals in Canada is increasing dramatically. It's one of the fastest growing segments of the Canadian population. And indeed, those individuals age 80 or 85 and older is the fastest growing segment of the Canadian population. And when you consider that there's a very high rate of dementia and mild cognitive impairment in those individuals, exceeding maybe 40 or 50%, then the numbers are increasing quite a lot. So estimates are that maybe by about 2030, there could be about 1 million individuals in Canada with some form of dementia.
Well, it just really highlights the need for us to, invest more, money into the care for those living with dementia, the diagnosis of it, the research, and support for caregivers that are in the communities looking after those living with dementia, or maybe those who are even undiagnosed, that we need to put, more investments in the work that we're doing. So thank you for that. Just to really, profiles what is actually happening in Canada with our older adults. And so I appreciate that response. I think Tom is going to ask a little bit more around our understanding around, just getting back to the reference around differentiating dementia and Alzheimer's, but what is like around that normal aging? So I think I'll turn it over to Tom.
Thank you. So it's a question, I guess, for all of you, Samir, Claire, and Jane. Raising awareness of dementia is imperative, given that Jane just shared about the current number of older adults diagnosed as living with dementia and the projected increase in the coming years. There are probably people who excuse their lack of memory as typical age-related memory loss, but they may actually have symptoms of dementia and have not seen a doctor or been diagnosed. If more people, not just older adults, reduced risks, we could slow the rates of dementia and the stigma that goes along with the condition. So Dr. Sinha, based on your years of experience as a geriatrician, how can people differentiate between what are typical signs of aging versus early signs of dementia?
Sometimes it's really hard to kind of differentiate these things, and I think that's why it's always important to work with one's healthcare provider if you're starting to become more worried about your memory. Certainly, as we age, there are natural changes that occur with our memory. Our processing time isn't as good. We may be a little bit more forgetful. But when your memory starts interfering with your day-to-day ability to do things that you used to be able to do, that's not normal. And if you start noticing that there are real changes that are occurring, it's important to see a healthcare provider. And there's two big reasons for this. One, this could be dementia. These could be early signs of dementia, but they could also be early signs of other issues that might be going on that aren't dementia. So, for example, if someone might have anemia, which is low blood counts, for example, they might have a vitamin deficiency. Their thyroid might be a bit wonky, for example, or they might be taking medications that might be clouding their memory and judgment. These are things that are often kind of reversible forms of memory problems that often by just tweaking one's medications or getting on the right treatment, we can actually reverse these issues. But sometimes we can't. And sometimes that's because there's an underlying dementia. But it's important to get that diagnosed as well, because while there's no cure or currently any major disease modifying treatments, there's a lot of things that we can do to help someone stay healthy and independent for as long as possible. And that's why if people are worried and say, this is not just the occasional forgetting a word or something, this is worrisome, then certainly I think the next step is to always talk to your healthcare provider next.
So thanks for that clarification. I think as you're both talking about this, the diagnosis of it, and you're seeing the signs, but I think a lot of times people get in denial that they don't want to be diagnosed, or they're fearful of getting that word from their doctor saying that, yeah, I have dementia, or even the family members. I think there's sometimes you see the repetitive patterns of the conversation that you've been having, and there must be some hesitancy. I know families have that hesitancy to even talk about it, to say, I'm really concerned about you, Mom, and starting that conversation can be really difficult, because if you're not right, you don't want to plant that seed, but at the same time, you want to make sure that there are mechanisms to get that diagnosis. So Jane, how important is it for people to get that diagnosis, and how do we have conversations with families to start talking about it if they are concerned, so that they would take the step to make the appointment? Or are there ways that families can support that process of going to the doctor so they don't feel alone in that process?
You're right, Ray. I mean, there is a lot of fear around things like dementia, changes in brain function, and a lot of stigma associated with it as well. And I work a lot with the aging population and the research community around aging. And one of the largest fears is actually dementia as people age. But it is important, I think, especially in light of what Samir has just said. It's important to get a diagnosis as early as possible. And that's not because there are any cures or that there are even any really effective treatments right now, but one can modify aspects of the way one lives to be able to improve general health. And so getting more exercise, sleeping adequately, eating well, getting out into nature and engaging with other people. Just some examples of things that promote overall health and well-being. And so the more someone feels healthy and confident, and engaged, the more they will have resilience to be able to deal with challenges such as a dementia diagnosis. And that includes the family and friends as well. So just changing some of these lifestyle factors can actually improve one's general health and well-being, and could actually change the course of the disease to some extent. There is now some evidence emerging that can be the case. Being active and in nature and exercising can decrease depression, anxiety, all of which can have a negative impact on cognitive function. So
Great,
getting
thank
that
you.
early diagnosis, making those life changes can be really important.
So, so people that are listening, if you're concerned about a loved one, or if you're an older adult and concerned about, things that are changing for yourself, that, to make that appointment and just even consult with your physician just to find out if this is, if this is normal, or if there's something else going on, like as Dr. Sinha said, there may be some other contributing factors that might be happening. So, getting that diagnosis is really helpful. So, Tom, maybe we can talk a little bit about just building on that around ageism, if that plays a factor.
Yes. Could you all provide your insights on whether ageism plays a role in the stigma around dementia? Claire, let's begin with you as a care partner working with families and paid caregivers, then Samir and Jane.
Yeah, I think if it's all right, maybe I'd just like to go back a little bit about the diagnosis, just to add something, because there's so much, from the perspective of the general population, when people hear the word dementia, they automatically think it only has to do with memory loss. And so many people, there's such a lack of public awareness and education as a whole about all of the symptoms. And in so many cases, it really starts with a significant change in behavior or personality, or the way somebody is speaking or managing finances. And so many cases of dementia go undiagnosed, or the diagnosis comes too late because people have missed these early warning signs that are so important. And with so many families that I work with, when people think, and what's so hard with dementia as compared to with other diseases, like when it's cancer, you may feel something or see something or see a lump, but in the early stages of dementia, the person still looks fine, right? And so many people can't imagine that as the disease evolves, the impact it's going to have on their activities of daily living. And so there really needs to be much more education done with regards to understanding the evolution of this disease. With regards to ageism, absolutely. I work with different ages of the population. So I work with people who have early onset dementia that are under the age of 60. The majority of the people that I'm working with are in their 70s. But when a family reaches out to me for a parent who's in their mid to late 80s or early 90s, so many times they come to me and say, I just came back from my family doctor and they said that there's nothing we can do, right? Or there's like, good luck, see you in 6 months. And it's almost like, oh, it's just normal aging when it isn't normal aging. So I really think that, that when families become better educated, they need to press on more, not just because somebody's in their mid 80s to just dismiss them.
Right. Jane, do you have any comments around ageism and that intersectionality around not the stigma associated with not getting a diagnosis, or even the way families understand it? Because I think you made a really good point, Claire, that it is sometimes the family members that dismiss this or don't pick up on those signs and just attribute it to just getting older, right?
Yeah, I think this is where public education is really critical around this, and the program that Claire is involved with actually is helping so much in this regard, helping people of all ages understand what normal aging looks like, and decreasing ageism just associated with that is an absolutely critical part of what we need to understand and what the general public needs to understand. And then I think that helps people understand that it's not just a normal process of aging, that, just because an individual is 80 or some relatively advanced age, that it's just naturally going to happen to them, because the odds are not that. And so I think really we need to engage much more in public education, understanding of what aging is and what changes associated with dementia look like.
Yeah, and I think the education goes to all age groups. It's not,
Yes.
Doesn't need to be just targeted at older adults. It's, it could be our children and those who are, middle-aged and looking after maybe their aging parents or in their 30s, 40s, because everyone needs to be aware about these signs, because as we know, there is early onset as well. So everyone, and those campaigns need to be targeted, to be developed for different target groups, but to get that awareness out to everyone. Dr. Sinha, do you have any other comments around that?
Well, yeah, just picking up on that, Rayanne, I think the importance is kind of just raising public awareness and education. So one of the things we talked about in our NIA report was that 74% of Canadians tell us that they have been affected by dementia. They either know someone or have known someone who has been affected by dementia. And these are people of all ages, right? So it's important to realize that that there are many people in our lives who will be living with this disease or affected by it, and that there are things we can do to better support them, and there are things that we can do ourselves to actually help prevent or delay dementia. So there's many things, at least 14 that have now been shown by the evidence that if we start doing some of these things, even starting at an early age, but it's never too late to start, we can actually lower our future risk. And some of these things that Jane was mentioning, for example, are things that if we do have a diagnosis of dementia, this can also further kind of, in some cases, delay and better support someone's delay some of the progression, but also support someone's overall health and well-being. So it's really important to raise awareness, because by doing this, we make sure that we are better promoting good brain health, but we're also promoting the fact that this is a disease and an issue that affects so many of us, that we'll want to make sure that we've got the right supports in place, and we're not just dismissing people with dementia or just thinking that there's nothing we can do, because there's a huge amount we can do, not only for people who are diagnosed with dementia, but also their care partners as well.
Yeah, thank you. And I think also media plays a role in the public awareness. It's not only just us as individuals and organizations and in our professions getting the word out, but when something happens, the media are there, but we want to make sure that it's portrayed and the messaging is in the right context, not as in a negative context, because we know ageism plays a role in how it is the messaging and communication is delivered. So, and I know there's so much work that we're all involved in conferences and initiatives to combat ageism, and it crosses all sectors and issues. And this is just another one of those issues that we need to, further address and make sure that it is on everyone's radar and that public awareness. And just building on the comment you said, Samir, around it's the caregivers as well. So I wanted to ask Claire that you have been a champion and advocate and consultant for over 20 years in this field, working with caregivers and older adults. And as a caregiver and a caregiver for your mother as well, who was diagnosed with dementia, can you share your experiences or insights on the challenges that caregivers may face when supporting an older adult or a friend that might have had a diagnosis or is living with dementia?
Sure. I normally give a 90-minute lecture on this topic, so I'll try to narrow it down. And I've also recently become a caregiver, actually, to one of my best girlfriends who's only 62. And wow. Well, I'll try to nail down the most pertinent topics. So in both cases, with regards to my late mother and my friend, they both suffered from what we call anosognosia, meaning that as a family member, as a friend, we have witnessed all of the changes that are happening, but they themselves are not aware, okay, or do not, they just cannot comprehend, won't comprehend. They have false beliefs. They think that we're out to get them, that, and so for many family members, when the person is not self-aware of what's happening, that's a very big challenge. The second thing is navigating that healthcare system. So even just getting that first diagnosis, because a lot of the symptoms are behavioral, some family members think I need to see a psychiatrist or a psychologist, and sometimes the family doctor may or may not be able to diagnose. So just navigating to get that first assessment is challenging. And then, when you get diagnosed with cancer or heart disease, you're being given a prescription of care. You're being given some direction. That's unfortunately not happening in the majority of time. The doctors are not presenting families with information about the disease, how to access support services in the community, what the next steps are. Many family members only see the doctor once or twice, right? And then it's really understanding the evolution of the disease. So again, it comes down to education, because people are not educated on the disease. They're kind of in a offensive aspect where they're just winging it all the time, right? And they're not prepared for the evolution of the disease, and they're not often aware of all the physical changes that it has. And so they're constantly feeling lost. So you think that you have everything under control, and then the disease is always moving. So families are, because of the lack of education, they're not prepared for the next stages. And it causes a lot of frustration. There's a lot of guilt. So a lot of family members don't try to seek out that support. They feel that only I can take care of my mother, my father, my husband, my wife. So inevitably, a big challenge for caregivers is burnout, which I myself had experienced, right? Because especially sandwich generation caregivers, you think that you can try to manage your family, care for aging parents, manage your job, and you just can't. So I think that, when it comes to caring for a person with dementia, it is absolutely imperative to understand this disease, because it is a disease that is ever evolving. When I work with families, I say you need to be one step ahead all the time. So if they're in the early stages, understand what may happen in the middle stages. And not only being as educated as possible about the disease, but understanding all the resources in the community that could support you, and have a plan B. So if plan A is you want to keep that person at home for as long as possible, you still have to have a plan B, that where would I go in the event that we have to transition, right? Because we don't know what happens in life. So there's so much information. And then you talk about even all the legal aspects that families have to do. It's one of the most expensive diseases to manage financially. So in addition of the care, understanding how to take care of the person, there's a whole financial commitment that also becomes involved in this journey.
I think it's important. I mean, in doing that pre-research and pre-planning, I think it's human nature that we wait for that crisis to happen, and then we go search for the resources, and that's not how we want it to play out, right? So, so I appreciate that, giving people that insight to, take initiative and look for the resources, look for what's available, just in case, and if they suspect things are going on, right? To not wait until it really gets to that crisis point.
And it can cause a lot of family conflict. So if people aren't planning and working together, it can cause a tremendous amount of conflict among the family members as well.
Mm-hmm. So I think Tom's going to ask a little bit more around caregiving, because, they are such an important role in somebody's journey when they're living with dementia.
Yes, actually, this is a topic that's very important for me personally, as I am a caregiver for my partner who is in the early stages of vascular dementia. And so I'm really interested in learning more about some of the challenges and issues that caregivers experience, and how to provide that care, ongoing, sort of around-the-clock care for somebody who sort of is dealing with dementia, and all of the other health issues, the changes in their physical ability, their cognitive abilities, and their emotional and sort of behavioral changes. So, Jane, as the number of people needing care increases, so too does the number of caregivers required to provide support. According to the Canadian Centre for Caregiver Excellence, 1 in 4 Canadians provide care to a friend, family member, or neighbor, and half of Canadians will do so at some point in their lives. Can you speak to any research that has been conducted on the reliance of the health system on caregivers and care partners to support older adults living with dementia?
Yeah, Tom, very interesting question. And this is an area where we actually need more research. That doesn't mean there hasn't been research conducted and there's not research ongoing, but we certainly need more research, particularly around ways of bringing services and people together. And I think Claire mentioned this, that one of the really critical points for caregivers, whether it's families, friends, or even professional caregivers that are employed people that are employed as caregivers, to know the resources that are available. And I think we really need much more emphasis placed on being able to ensure that the resources that are available are widely known, that people understand how to access those, and that there is sufficient resource made available at no cost or low cost, so that virtually anybody can access those resources. And so I think this is where we need much more policy-based research. We need implementation science research. We need evaluative science research to be able to look at programs, do program evaluation, understand what works, where it works, what sort of communities, what populations, and then how to take those best programs and to scale them and spread them to other communities so that they're available more widely. Canada's a challenge from the perspective that we have urban settings, but we've got vast rural settings. And so ensuring that resources are available in both urban settings and well available within rural and remote settings is quite a challenge. So understanding the sorts of programs, researching the types of programs that could be available, and then having the data, evidence available to policymakers to be able to make those important policy decisions. And then also, Canada is becoming increasingly ethnically diverse. We're a wonderful multicultural country. And so making sure that programs and opportunities are available for all persons on an equitable basis, and that whatever models of care are available are culturally safe for all. So a lot of work still needs to be done in this area, and it's an area that my institute is working on quite a bit.
Yeah, that's great. I was just going to say that we had done 2 prior interviews with the Canadian Centre for Caregiver Excellence, as well as with the Ontario Caregiver Organization. And, one of the themes or trends that sort of came out and some of the reports as well is that we're not going to have there's been a decrease in people as caregivers for their families, that maybe they don't want to take on that role. The financial burden, I think, Jane, as you just said, that there is a financial cost to that. But the healthcare, you get, discharged from hospital, you go home, and there's an assumption that someone's going to be there to look after you. But we know that there's many seniors are living isolated, alone, and like you say, rural settings, that there may not be those supports. So I think we're going to see maybe a change, or they're going to be more. We need to have better awareness, as we're saying, and that commitment to provide allocated funds for the services in the community, because more people are living in community, waiting if they are looking for care, and maybe a wait to get into care. So I think we need to think about that in terms of the reliance that we're relying on the family members who may not have the skills or training to do that job. And I don't know, Claire, if you have any other comments on that, as I know Tom has one other thing they may want to ask.
No, I mean, that's it. I was just thinking as you were speaking, I know that there's a lot of new technology that's coming up to try to keep people at home for as long as possible. But in my opinion, when it comes to somebody who's living alone with dementia, that technology doesn't necessarily work all the time, because you really have to have supervision. And I think the lack of information by the public is what you said earlier, is how long it takes to access care. So for example, in Quebec, if you need to access a long-term care facility, it's up to 2 years. Just to have a social worker come and do an initial assessment, it could take up to 6 months. So there's so much education that is needed by the public or by caregivers or families once a diagnosis is made. And a lot of people tend to say, it's okay, we're not there yet, I don't need to look into that yet. But I tell everybody that I work with, you need to be one step ahead. Like, do your research now so that when the time comes that you're prepared. Because too many people wait until a crisis occurs and try to access that support, and it's just not readily available, unless, of course, you have the financial means to pay in the private system.
Thank you, Dr. Sinha, Dr. Rylett, and Claire, for your leadership and continued involvement in expanding public awareness on dementia across Canadian jurisdictions to improve knowledge, reduce risk, and challenge stigmas. I encourage all of our listeners to become more knowledgeable of the 14 modifiable risk factors that can delay or prevent dementia. Challenge the stigma, stereotypes, and discrimination associated with the disease, and learn about the supports, services, and programs for caregivers. Take a moment to visit our guest websites. The National Institute on Aging has a wealth of information and research and resources. For those seeking additional caregiver support and programs, check out Caregiver, Crosswalk Inc., and McGill Cares. There are excellent tools, fact sheets, and more that you can download for free. You can find links to these websites and other references mentioned in today's episodes in the show notes of today's episode. And follow up to our discussion on abuse prevention. If you're looking for more information for yourself, friends, or families that you are concerned about, visit our website at eapon.ca, where you'll find fact sheets and other educational materials that are also free to download. Or if you need someone to speak to for assistance, call our office at 1-833-916-6728. Aging Vibrantly, Conversations to Empower Seniors is hosted by Rayanne Rideout, produced by Lisa Whitfield, and edited by Todd Miller of the Podcast Experts. The original music was produced by Redpath Audio. We want to thank Help Age Canada for their financial support to produce this season's podcast. Please rate, review, and subscribe to Aging Vibrantly wherever you get your podcast. If you prefer to watch the episode interview, all episodes are available on Elder Abuse Prevention Ontario's YouTube channel. Be sure to check us out. We have also launched a new listener feedback survey. We want to hear from you, your comments and suggestions. Your opinion really matters to us. So take a moment to fill out our listener feedback survey now. You'll find the link in the show notes below. Until next time, stay vibrant.